Welcome, everybody. We're back with three plastic surgeons and a microphone. Actually, four. Doesn't count because he's Canadian from Toronto. Dr. Tong is joining us. So, as always, I'm Dr. Sal Pacella from San Diego, California. We've got Dr. Sam Jejurikar from Dallas, Texas, Dr. Sam Rhee from Northern New Jersey, New York City area, and of course, my good friend, Dr. Larry Tong from the beautiful city of Toronto, Ontario. How are you guys today?
Great.
Doing great.
Happy New Year. Happy New Year.
Awesome. Great to catch up with you guys again. Fantastic. Today we've got a really fantastic topic. We're talking about the latest statistics from our main society in plastic surgery, the American Society of Plastic Surgeons. We're going to go over a few of the results for the top 5 procedures that are performed in the United States. Prior to that, we're just going to go through a regular disclaimer. Dr. J.
All right. So for our listeners, this show is not a substitute for professional medical advice, diagnosis, or treatment. This show is for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment. After appropriate discussion, always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care. Never disregard professional medical advice or delay seeking advice because of something you may see in this show. Back to you, Dr. Pacella.
All right. So I'm just going to give you guys a list of the top 5 procedures here. We could dive a little bit into the statistics. So before we do that, I just want to tell you, so the ASPS is the main society organization for governed plastic surgery. So it sets ethical standards, it sets processes for how we evaluate patients, safety standards. So it is kind of cream of the crop society that most of us belong to as plastic surgeons. So every year they send out a survey for ASPS members to describe their practice and give generalized numbers of types of procedures we perform. And these are kind of interesting and fun to go through because it really hints at what the trends are across the country. And, we're a microcosm of the world. So we really gel with things that are occurring in other parts of the world. So I'm going to give you the top 5 in order. So there are roughly about 1.5 million cosmetic procedures, surgical procedures performed in 2022. The top one is liposuction. The second one is breast augmentation. The third is tummy tucks or abdominoplasty. The fourth is breast lift. And the fifth is eyelid surgery. So we can kind of dive into the numbers a little bit here, but why don't we go around the screen here and talk about just how this gels or how this reflects your specific practice? Maybe we'll start with Dr. T. Dr.
All right.
Tong.
Well, thank you very much, Sal. So yeah, this trend follows very closely with, I guess, most of our practices. I think one of the interesting things that you'll see is that that you didn't mention, Sal, but I'm sure you'll probably touch on, is that during the last several years, the growth in cosmetic surgery or aesthetic surgery has really outpaced reconstructive surgery. And I think that maybe has to do with the pandemic. And I'm not sure if you guys saw that as well, but during the pandemic, there was a very significant increase in cosmetic surgery procedures. And I'm just wondering if you guys noted the same thing.
Right. So just before we talk about that, let me. Sorry, Sam. Just from the number standpoint, 1.5 million cosmetic surgical procedures and 1.02 reconstructive procedures. So cosmetic procedures have outpaced reconstructive surgery. So go ahead. Sorry.
No, I think Dr. Tong is right. What he's referring to during the pandemic is the access to do cases in hospitals largely at various times sort of went away. And so many of us had to make alternate plans or sort of change our practices. And so for me specifically during the pandemic was the time I basically gave up doing reconstructive surgery. I had still sort of done some during that time, but the pandemic made it nearly impossible. The other thing too, which, you hate to talk about it, but reimbursement in general across the board in the US for reconstructive surgery is slowly trickling down every year. And with the increase in demand for aesthetic surgery, I think most plastic surgeons are finding that it's, not in their financial best interest to do as much reconstructive surgery as they had done, at least relative to aesthetic surgery. So I think those two trends, at least, in my mind, would explain why we're seeing this.
This tracks with me. I stopped taking ER call and stopped doing reconstructive surgeries probably about 5 years ago. And it was because it was a lifestyle choice on one hand, because I've taken call for 20 some years, as ever since I was an intern. And after a while, that stuff gets old pretty quick to have to come in at 3 a.m. for some ditzel thing. And then the other thing is the reimbursements going down. And if you look at it, that it kind of blows me away. If you ask people in the world, what is more common? Tumor removal, hand surgery, breast reconstruction, scar revisions, or cosmetic stuff like breast lifts, breast augmentations, liposuction, you would think there would be more reconstructive. There's more of a reconstructive need out there, but it's really not. I mean, there's 50% more cosmetic procedures that were performed in 2022. Yes, the pandemic played a big role in that, but let's face it, we're going where the money is, and this is where the money is. It's crazy how much demand there is for cosmetic surgery, but we're just following what people are looking for. And we're also following what society is reimbursing us for. And if people don't like these numbers, if they don't like this trend, if they feel like this is not what we should be doing as plastic surgeons, well, then the game needs to change. The rules need to change. The way they set up medicine in the United States needs to change. So you could hate what did it say? Don't hate the playa, hate the game, or whatever it is. Like, I don't know. Larry would know better. He's more of a basketball fan. But
Thank
I
you.
would, but I would say this: like, what do you expect us to do as plastic surgeons? Like, we are fulfilling what is out there as needs. And to me, lipo, breast aug, tummy tuck, breast lift, eyelid surgery, they track for me as my top 5 types of procedures too.
So a couple comments. So of anybody in this group here, I'd probably do most of reconstructive surgery. And, I have a kind of a unique perspective on it. I think, I look at the ethical concerns and then, of course, the practical concerns with this. So can you make much more doing cosmetic surgery? Yes, but maybe yes and no. Okay. I think depending on the situation you're in, economically or financially, depending on the reimbursement group that you're with, the payer profile, reconstructive surgery can be quite lucrative if you dive into it way. And so, in my practice, I do a tremendous amount of skin cancer reconstruction. Those cases are relatively short periods of time, an hour or so. We can do a lot of them in a series, and the reimbursement is not bad, but it's fantastic. So I've been able to find a really good niche with doing reconstructive surgery. And from an ethical perspective, I would say, I sort of look at this like a continuum, specifically with related to eyelid surgery. So let's say we have eyelid complications. There's a fine line between cosmetic complications in the eyelid and functional complications. And so, an ectropion can be cosmetically displeasing, meaning drooping of the eye, but it can also be very functional. And so, we sort of work with patients based on their symptomatology, their insurance plan, et cetera. And so I sort of see this as, as plastic surgeons, we need to own anatomic areas. We need to own the face, we need to own the nose, we need to own the breast. And in my mind, there's not a way to really own that unless you're really able to deal with disease, trauma, and complications. And so, and I think we have to be cautious as plastic surgeons because on the outskirts of the community, there are providers infringing on reconstructive surgery. There are breast surgeons that are now sort of doing implant reconstructions. There are general surgeons that doing large abdominal wall reconstructions. There's head and neck surgeons doing advanced facial reconstructive surgery. And I think as a society, we have to own that. So, my thoughts.
I think you're right, Sal. But what I would also say is when it comes to the world of aesthetic surgery, we've seen this for a long time as well, where you see general surgeons, family practitioners, otolaryngologists that are operating throughout the course of the body, doing body and facial aesthetic surgery. And so we've dealt with this for a while. I'll just say, from my personal perspective, I love doing reconstructive surgery. I always have enjoyed doing it. My personal setup as basically a solo practitioner and not having the benefit of facility-based reimbursement. So for our listeners, whenever you get a reconstructive surgery that's reimbursed by your insurance company, the provider gets a relatively small payment. The majority of money actually goes to the facility. And so, not having, not working for a large healthcare organization where it's in their benefit to keep a large pipeline of those cases going through there, the financial reimbursement for me has always been largely limited to that small piece of the pie or the facility fee. Meanwhile, you look at what's going on with the economy. Inflation has run rampant the last 2 years. So the cost of running my business has gone up. My employee salaries have gone up. The demand for aesthetic surgery has gone up. So what you can charge for that's gone up as well. Meanwhile, reimbursement for reconstructive surgery has gone down. And so it wasn't really a choice based off of the fact that I love doing aesthetic surgery that much more than reconstructive surgery. I love doing reconstructive surgery, just like I always have aesthetic surgery. The economic realities were, in order for my employees to make more money in this inflationary environment, we needed to bring in more revenue. And that just wasn't going to happen by doing reconstructive surgery.
I mean, I'll chime in there as well, because as you guys know, I trained as a craniofacial guy, and my first 2 jobs in practice were doing craniofacial surgery and pediatric plastic surgery. We all trained at Michigan, and the amount of reconstructive training versus cosmetic training was way, way, way over in favor of reconstructive training. So you're right, Sal. We felt comfortable operating, and we feel comfortable operating as plastic surgeons everywhere from head to toe. And that was something that our bosses sort of inculcated in us and sort of trained us to feel confident about no matter where we were. They often told us over and over again, we were the surgeon, the best surgeon, the best surgeon available out there because of the breadth and depth of our knowledge anatomically and where we operated. But for me as a craniofacial guy, I loved those procedures. I loved doing clefts. I loved doing big head cases. But the economic reality is that you don't need nearly as many of those craniofacial guys as you do aesthetic. Let's just face it. And the minute I felt like I couldn't live in Manhattan, or I couldn't stay in Manhattan, which is where the biggest centers were in my area, I couldn't make a living doing that by myself. Like I had to be part of a big system, like Sam said. And without that, I had to make real money. And the only way you're really going to make real money out there as a solo guy is you can try to find that special sort of situation where you're doing enough reconstructives to make real money. But I would say the majority of plastic surgeons are going to sort of skew aesthetic, and insurances and the hassle with reimbursement notwithstanding. Like you said, that's a big hassle, and it's becoming more of a hassle probably every year. I mean, what my concern also is, though, is with these younger surgeons, like, let's face it, can you survive as a newly minted plastic surgeon out there by saying, except for, hand surgery, I think is one thing that will always sort of help carry your practice when you start. But for everything else, like as a maxillofacial guy, as some of these other specialty reconstructive guys, like, are you do we really need 1 million more of those guys? Like, how can you survive as a new plastic surgeon? I would say a lot of them are already looking at the economic reality and skewing faster towards aesthetics than ever before.
Well, let's shift
I think
gears a
that's
little
well
bit.
said.
I want to go back to the this here. So just from the number standpoint, liposuction versus breast augmentation. You got 325,000 procedures in liposuction, about 300,000 in breast augmentation. And what I'm curious about is liposuction listed as a primary procedure or as an additional procedure? So it's, if I'm doing a breast lift, I oftentimes do a little liposuction on the sides of the breast. If I'm doing, a cosmetic facelift somewhere and I'm doing some liposuction around the neck, do you think that these numbers are indicative of liposuction as pure abdominal body contouring liposuction or as additional add-ons? Dr. Tong.
I think these are probably listed as primary procedures. I think that the trend in cosmetic plastic surgery in North America is that most or many plastic surgeons who come out are pretty comfortable with doing body procedures, and maybe not as comfortable or have as much experience doing facial procedures. I certainly found that to be the case when I came out in practice. And then, as you get more experience, you get more and more comfortable. But I think that's reflected in why the procedures, the cosmetic procedures are more skewed toward body procedures. But I think that, liposuction is probably the most common procedures that we do, even if somebody does a good portion of the practice with facial cosmetic procedures.
I think the other thing is I know that there's a lot of encroachment both on the reconstructive side and cosmetic side in terms of other specialties out there, but excellence, I believe, always wins. Like, if you are a really good surgeon, and I'll be agnostic here. I'm not going to say that plastic surgeons are all really good surgeons or all non-plastic surgeons are sucky surgeons. Like, if you're a really good surgeon and you demonstrate that, it shows. Like, when I see Larry Tong and what he does with his facial stuff that he's, we've seen his talks about, or Sal, when you show your reconstructive, your eye work, like, that stuff blows me away. Like, you can't just take anybody, even a relatively well-trained plastic surgeon, and take them to that level without a lot of experience, a lot of talent, and a lot of skill. And so when I look at these procedures and I look at, like, am I worried about our specialty? Am I worried about, encroachment or, people taking away our piece of the pie? If you go to a program and you're incredibly well trained, if you go out there and you're smart and you learn and you become more experienced, you're going to do incredibly well. Unfortunately, it looks like it's going to be more on the cosmetic side for most of the young plastic surgeons out there. Like, that's just the reality. I don't know if you're going to talk about the minimally invasive stuff, Sal, but I think that that's even more telling in terms of where the future of plastic surgery is.
In fact, that's where I was going to go. Because Sal's question was, do we think these are primary breast augmentation or primary liposuction versus sort of adjuncts? Well, if you look around, there are so many of these, chains, if whether that operate in multiple cities that are doing awake liposuction. And that just sort of shows the general trend towards minimally invasive or lesser invasive procedures. Like, you're looking at 325,000 liposuction cases versus over 8 million neuromodulators versus over 4.5 million, fillers. In general, people are looking to do minimally or lower invasive procedures at a rate that we've never seen before. I think it was almost 75% of an increase from 2019 to 2024 in terms of the number of neuromodulators or Botox cases. And I think that's a trend that we really need to be paying attention to because that's, I think, where society is going. As technology is getting better, as Botox and fillers are lasting longer and treatments are getting better, we're just going to see more and more of that and possibly less surgery in the future.
And that's such a huge topic.
Yeah, that's definitely true.
Go ahead, Larry. Sorry.
Oh, thanks, Al. I was just going to say that, part of the reason for that increase in numbers is also because these minimally invasive procedures are generally much more accessible in terms of cost and recovery. But I think that it also should be noted that minimally invasive procedures do not replace surgical procedures. So there's definitely things like on the face, if you're, probably, you guys probably do something called liquid rhinoplasty, which is using fillers to create a certain look to the nose. And I'll have patients come in and they'll want a liquid rhinoplasty, but oftentimes I'll have to explain to them what the limitations are with that type of procedure, because the public sometimes has a view that you can substitute these minimally invasive procedures for actual surgery, and that also goes with things like liposuction. You guys probably do some cool sculpting, but I can tell you that that is definitely not a substitute for liposuction. In certain patients, maybe it comes pretty close, but I think it's important to know that minimally invasive procedures are probably more popular because they're easier to access. There's less financial commitment to it. You can recover from them much easier, and that's why they've been very popular. I'm sure the pandemic has contributed, or did contribute to that. So minimally invasive procedures are great, but we just have to be aware that they do have the limitations as well.
How does this track with you guys? Like, I know minimally invasive stuff like Botox, like fillers, all this stuff is growing, and I can see it, and I see it reflected around me, and I see it reflected in my, I don't know if, I mean, I find the minimally invasive stuff to be sort of, I don't want to say boring, but it's not what I feel like my bread and butter is. My bread and butter is surgery. I want to do minimally invasive procedures well. I need to know how to be on the cutting edge of this stuff and do it in a really great fashion, but it's because I want to be able to offer everything to my patients, not necessarily because I love doing fillers more than anything else, or I loved injecting Botox more than anything else. But I feel like I don't know how these trends are going to play in the future. It worries me a little bit as a surgeon, I suppose.
Well, this
I think we
brings me
all like
to
doing bigger procedures.
so this
Oh,
brings me
Cal,
to
what I was going to say is we're surgeons.
I think we got a little bit of a delay here, so it's gel.
Who's delayed, me or? All right. Well, here's what I was going to say. So I think
Is
that
this on?
we
Is this
as
on?
surgeons like doing big. We like doing big operations. That's why we went into surgery. But as a patient, if I had my choice between something that had less of a downtime and, I would definitely, and less expense, I would choose that. I can only say that, in my practice, because we do have a really large med spa and we're about to undergo a huge expansion of it. The revenue growth in the med spa over the last 5 years has been about 300%. Like, it has exploded, and it's Botox and fillers. I mean, we have 5 full-time injectors there. It's radio frequency treatments. It's laser treatments. It's, there's a huge demand for this. And most of these procedures are not being done by board certified plastic surgeons. In fact, most of them aren't even done by physicians in the US. They're being done by nurse injectors, estheticians, you name it. So what we may like doing as surgeons doesn't necessarily jive with what people want.
I think the prediction for me, just for my last thing to say is that if you are an aesthetic plastic surgeon or a plastic surgeon who does a lot of aesthetics, you had better set up a med spa. You had better set up ancillary services to do minimally invasive stuff, because it's only going to grow. And I think your trend, Sam, of what you just mentioned in your practice and in your business is what most young plastic surgeons should be following as their strategy or blueprint for success. If you don't have some toe or foot or big part of your practice in growing your participation in minimally invasive procedures, you're gonna be missing out.
Well, gents, we're
We
running
need to
about
wait for
20.
Sal. All right,
we're-
now he's ready.
We're right at about 25 minutes, so we're about hit our timing here. So, well, we want to thank all of our surgeons here today, and that was great chatting about the latest trends. So, otherwise, we'll be signing off.